characterizing length of a stab wound is normally less than that of the width of a weapon. Logically, length of the stab wound should be equal to the width of the stabbing weapon. However, this is not so because as soon as the weapon is withdrawn, the severed elastic fibers in the skin tend to recoil, and the actual length of the wound is slightly diminished to IS. To predict the correct width of the weapon, the edges of the bone must be brought together by fingers or by an adhesive tape. This releases the tension and the elastic fibers of the wound display its original length, which should be then be measured. Dimension of a weapon may be wrongly reported. It is if gapping is not accounted for original wound, then a weapon is within the wound accurately reflect the width of a weapon. As weapon is withdrawn, the skin gaps and the length may be reduced to x2, x-1 by a. An inexperienced pathologist may report this as the width of the weapon. Restoring the wound with an adhesive tape restores the wound and allows pathologists to correctly assess the width of the weapon. Length of the stab wound in some cases may be more than the width of the weapon. Deliberate movement of the weapon during its withdrawal from the body may tend to elongate the wound, giving rise to a R greater than the normal length. Width of a stab may not indicate the true thickness of the blade because of retraction of the wound edges after knife is withdrawn. If the weapon has a sharp margin edge, knife, dagger margins are clean cut incised stab wound. If weapon has a rounded edge, example cricket stem, ice pick, pencil, screwdriver, etc., margins are conduced and lacerated stab wound, hilt marker. If the stabbing weapon has a hilt, it has been thrust. If the knife has a hilt and it has been thrust completely and there will be a hilt abrasion at one side, this will be enable the forensic pathologist to predict the nature of the weapon. Note that the stab wound is single-edged, enabling also to predict the edge of the knife. Only there may be an abrasion surrounding the stab wound representing the hilt. Incised and lacerated stab wound. If the margins of the stab wound are clean cut, this is called an incised stab wound, typically produced by sharp knife. If ragged, rough and tough, conduced, it is a lacerated stab wound, typically produced by pointed end of a cricket stem, iron rod, etc. With the greater dimension, depth is the greatest dimension in stab wound. Assessing depth in the living, a stab wound must never be probed in order to assess the depth, as it may disturb a loose clot, may lead to fatal hemorrhages, may even bring charges of negligence against the doctor, and produce false strikes. It should always be done in the OT, and the wound is being repaired in the dead. Radio-opaque dye must be injected in the track and X-ray taken. Alternatively, incision is made at the side of the stab wound. Tissues dissected parallelly reveals depth without disturbing the actual wound. A pliable rubber tubing may be introduced gently, then taken out and measured. Once measured, the tubing may be made more rigid by inserting a probe. Comparison of a depth with the length of knife recovered. Knife partially thrusted, depth will be less than the length of the weapon. Knife fully thrusted on the underlying surface, chest wall, depth will be equal to the length of the weapon. A knife fully thrusted on the yielding surface, example abdomen, depth will be more than the length of the knife. Because force of the thrust pushes the yielding surface inward, potential yielding surfaces are abdomen, chest only in the perineum, breast, buttock, thigh. Depth of the stab is usually less than or equal to the length of the stabbing weapon, depending upon how far the weapon has been thrust inside. When a knife of length is the thrust, partially a wound of less dimension X is formed, and the thrust is fully dimensional would be same as the length of the weapon. Other situation which may produce similar problems of interpretation stress during tension, as happens during fight, abdomen may naturally be contracted inward. Naturally, mobility of internal organs during struggle, bending forward, backward, sideways, etc. Change of the position of the viscera during autopsy. As the body is in a lying down position, wounds on the chest, depth of the wound may be greater than the length of the weapon. Depth of the wound may be greater than the length of the weapon. Represents the situation, the moment of stabbing. Length enables the time to reach at a point A. Lung collapses. Interpret the depth of the stab wound. At the moment of stab, the resilient abdomen is pushed in, enabling a length of knife of length reach up to a point A. At the time of autopsy, the abdomen was recoiled back to its original position by a distant X. The forensic pathologist notices the distance between the stab wound W and the point A, comes to an erroneous conclusion that the length of the weapon may be L plus X. Police, however, has recovered a knife whose length is L. An inexperienced pathologist may opinion that the recovered weapon cannot cause the said injury. Similar interpretation may be occurring in stab wound of chest, etc. 2. The stabs of chest wound may produce problem of interpretation of length of the knife. Like abdominal stab, stab of chest wound may produce problems of interpretation of the length of knife. Points up to which a knife was thrust. Stab entry wound. Point A recedes backwards for a distance X during the collapse of lung and comes to a position of new point posteriorly, causing point A to proceed backward to another point X. An inexperienced pathologist opined the length of the weapon was 1%. Natural movement of the chest goes during inspiration and expression may also be considered when interpreting the depth of the wound. Force can only be obtained subjectively from a least pressure to greatest. It can be obtained as a slight force, moderate force, considerable force and penetration. Factors influencing the weapon. Condition of the stabbing weapon. Sharpness of the tip. The most important factor in determining the depth. Once the tips has penetrated the skin, thrust of the knife, even if not sharper, passes with a relative ease. A blunt pointed instrument depends on the perfect stand will be considered force to penetrate the skin. Width of the blade. Blade of lesser width penetrate deeper because of lesser friction offered by skin. Thickness of blade. Thinner blade penetrate deeper. Lesser friction. Single-edged or double-edged. Double-edged weapon penetrate deeper. Resistance offered by tissue. The tissues providing maximum resistance in order of bone, calcified cartilage, uncalcified cartilage, skin, nature of clothing which more of resistance, multiple layers of tougher cloth, leather coat, belt, jacket, vest, resulted in shallower relative moment between a body and knife. The speed of knife is more, or the body falls on it, the relatively greater moment, and the depth will be more. Degree of skin stretching, stretched skin over chest is easier to penetrate the than last skin. Angle of strike increases penetration when knife strikes perpendicularly, decreases penetration when it strikes at an angle. Shape. Cleavage lines of lung. These are lines within the skin along with which the dense vital work of an intimately intermingled dermal collagen and elastic fibers is arranged. He was, however, the first surgeon Dupuytren who was also classified the depth of wound. First drew attention to their clinical significance by experimenting on corpses. Dupuytren found that he could not make a circular hole in the skin with a circular instrument. Hammer used the same puncturing the technique to determine direction of leaves, lines, and areas. They are arranged in parallel rows which are same in all persons. In the extremities they run longitudinally in the neck and trunk circumferentially. Stab wound which runs across the wound causes a gapping. A parallel cut does not, and an oblique cut produces an oval, sometimes a crescentic or semicircular wound. Gapping produced along different cuts along the previous lines of line. A single line of liner showing direction of tension. These lines are cut across as elastic fibers retract like a rubber band, produces gapping. A cut parallel does not injure an elastic fibers. There is no gapping. Producing a cut parallel to the liner does not injure an elastic, thus no gapping. An oblique cut several lines produce an oval wound. Shape of the stab wound. Normally it is slit shaped with acute angles, but it would depend upon previous lines of liner. The same weapon may produce different sizes of wound on different parts of the body, depending upon the course of the lines, depth of penetration, direction of thrust, movement of blade within the wound, movement of handle, blade, gripper, cross guard or a guard hilt, ricasso, back, blunted and spine edge, sharp wound, deep penetration, level and superficial penetration. Shape of stab wound. Normally it is slit shape with acute angle, but it depends upon previous lines of shape of weapon, tenseness of wrinkling of skin, shapes of weapon influencing shapes of stab wound. A single-edged weapon produced teardrop or raindrop, triangle or wedge shaped. This angle is produced by sharp edges, sharp, and the other possible one is rounded, blended, or squared off. Sometimes the blunt edge causes split so that the wound appears like the tail of a fish tailing a fish tail wound. 12.493. Edge A of the wound is produced by the sharp edge of the stabbing weapon, while the other edge of the wound represented by the triangular blade. It is produced by the blunt edge of the BCD. It's actually a small triangular flap of the skin. The base of the triangle is BD. Mirror the other blunt edge of the stabbing weapon. If one removes this triangular wedge of tissue, one would left with a typical wedge-shaped wound seen in target single-edged weapon. Fishtailing is thus noticing, but the usual wedge-shaped wound, there is a small triangular piece of skin remains attached to the blunt with the appearance of a fishtail. Single-edged weapon, double-edged weapon. Stab wound produced by a single-edged weapon. Teardrop or raindrop, triangular or wedge-shaped weapon, fishtail wound, or double-edged weapon, spindle-shaped. Double-edged weapon produces elliptical, slit-like or spindle-shaped wound. Both ends are sharp. Single-edged produces spindle-shaped wound. If some length of wound with knife near the tip of the was a double-edged and the skin was too elastic, the angle corresponding to the blunt wedge would reflect the shape of initial few centimeters. This weapon is thrust deeper, excessive elasticity would letting the weapon through the corresponding change in shape. Multiple stab wound and stab was in double-edged weapon, and the shape of the wound are sharp. Penetrating at an oblique angle. As the knife perforates at an angle, the blunt edge weapon does not impart the shape as does not go. A single or double-edged weapon producing a wound with both blunts and bolts and blood. If weapon was thrust to the level of ricasso, short or unsharpened section of the blade between the cutting edge and the guard. In both cases, the correct shape of the wound weapon may be given by examining the serosal plane, pleural, pericardial, peritoneal surface, liver capsule, muscle fascia, which clearly show the wedge shape. Thus, in multiple wounds, examination of all wound is necessarily before opinion upon the nature of the weapon. Possibility of multiple weapon, both single and double-edged, must also be kept in mind. A round object with a folded end like an ice pick or spear produces a circular wound, may resemble a small caliber bullet wound. Leon Trotsky, the famous Russian revolutionary, was assassinated by mountaineering ice axe, much like an ice pick, a rounded object with a blunted and a pointed stick or ball point. When a metal rod produces a circular wound with a bruised, verted or a ragged end. Blunder the tip, coils or more stellate would be the whole used techniques. Such weapons are likely to be rusted or dirty foreign material. Example, dirt, splinters, rust could be found within the bone. Pointed square weapon example, screwdriver produces a cross-shaped injury. Example, each of 4 edges producing example. Fall on a pointed article produces circular wound. Stabbing with a fork produces clusters of targeted wound depending upon the number of holes. A two-edged fork may produce a two separate wound. Their distance depending upon the angle at which is straight, and an opening scissor would produce a similar wound. A stab wound with a two prolonged fork and an open scissor are paired, and lead an inexperienced pathologist. To conclude that victims were stabbed twice. In case of fork, the distance between the pair would depend upon the angle at which it was taken. In case of scissor, the degree to which it was open. Thick, relatively blunt, edged weapon. Bayonets produces penetrating wound, excessive laceration, around stabbing followed by rocking, twisting or moving around L or V-shaped wound with one limb corresponding to main or a primary wound, and other an extension of as it exists with a knife with a serrated edge produces a ragged wound. Direction: penetrating at an angle, beveled margin on one side and underlying cut on the other side. Weapon withdrawn partially on thrust again. Externally, only one entry wound would be visible, but two or more punctures may be seen in a soft parts. Opinion: proper examination of stab wound enabled the pathologist to obtain upon amount of force used, dimension of the weapon, direction in which a weapon can hit the victim, movement of knife with the wood, taper of blade, type of weapon. Description of a typical stab wound from other sources. Stab wound 5 cm and 4 mm in the abdominal cavity deep on the left lower abdomen, placed obliquely with inner roller end lower than the outer end. It is a spindle shaped with an angle circular margins are clean cut and contaminated with any foreign matter. The lower cut outer margin is beveled, the upper inner margin is split, and the center of the wound is 3 cm above the midpoint of left inguinal ligament, 2.5 cm below the outer umbilicus, and 7 cm to the right of media. The track enters abdomen through peritoneum and makes 2 cuts below through another, then enters the root of mesentery, cutting the interior mesenteric artery. The total length of track is 10.5 cm on a fully distant abdomen. About 1,200 cc of blood was present in abdominal cavity in carotid and produced a complication of embolism, especially in stabs of neck vessels, stroking due to inhalation of blood, hemorrhages, infection, pneumothorax. Medical legal importance of stab wound: a concealed puncture wound used homicidally. Depth of the wound indicates force used. Direction and dimension of wound indicate the relative position of the assailant and the victim. Manner of production: suicide, accident, homicide may be determined. Harakiri, cutting the belly, usually of a suicidal stab wound of the abdomen at one time used as a capital punishment. Procedure: the victim inflicts a single large wound of the abdomen with a tando or a ceremonial Japanese words while in sitting position and falls forward upon it and pull out the intestine, cause of death, excessive bleeding, sudden decrease in abdominal pressure, intra-abdominal pressure, decrease in cardiac rate, sudden cardiac collapse. Multiplicity of wound indicates overkilling. More wound is infected than necessary to kill it. This happens in sexual and revenge murders. Shape of wound indicates class and type of weapon, single-edged, double-edged. Time of assault can be determined by assessing the stab. Age of the stab must be differentiated from incised and lacerated wound. Thank you.